This is an analysis looking at safety of the ide-cel product compared to standard of care therapies. The KarMMa-3 study compared patients' outcomes, whether they received ide-cel, a CAR-T product, or different standard of care regimens. And patients were randomized 2-to-1 to receive either the CAR-T, ide-cel, or the standard of care regimens. Patients were triple class exposed, so they received an IMiD, a proteasome inhibitor, and a CD38 antibodies. And a lot of the patients actually had, triple class refractory disease, and they had to have 2 to 4 prior lines of therapy. Now, we've known that ide-cel has a high response rate in advanced myeloma patients, but this study looked specifically at earlier relapse, so 2 to 4 prior lines. And we wanted to look specifically at the safety. Now, what a lot of us think about safety in terms of CAR-T is cytokine release syndrome and some of those immediate safety signals. But here specifically, we focused on cytopenias and infection risk. And we also looked at second primary malignancy to see if there's a signal of an increased second primary malignancy. In summary here, what we found was that patients who received ide-cel had an increased risk of cytopenia, but it was limited to the first 3 months after therapy, and subsequently the rate of cytopenia was lower and similar in both groups. In addition, this was the same case for bacterial infection. Viral and fungal infection were not increased with ide-cel compared to standard of care. And in terms of second primary malignancy, we haven't found an increased rate of second primary malignancy with ide-cel. So overall, the safety signal is still not changed from what we kind of had anticipated. The cytopenias we manage typically with growth factor support, and the infections, there's a whole bit of trying to look at how do we prevent infection and keep patients away from these complications.